1. Autism Spectrum Disorder, ASD. Autism is a disease manifested by problems with communication and social interaction. Some problems with movement, sensory disorders, and repetitive behaviors can occur. The rise in autism increased significantly in 1983, with the rise in consumption of aspartame in carbonated beverages, also known as diet soda, and has continued to do so as aspartame consumption has grown. Autism has been observed more often among children whose mother was obese or suffered from diabetes, both of whom may demonstrate increased aspartame consumption. In the process of digestion, 11% of the aspartame is transformed into pure methanol, which is known to be neurologic teratogen and poison for humans. Methanol is metabolized in our body to formaldehyde by alcohol dehydrogenase class 1, ADH, and then oxidized to formic acid in the cytosol. When ADH is not available, formaldehyde can react with DNA and RNA. The products can cross-link with basic proteins in the cytosol and inactivate them. Such changes have been found in the brains of people suffering from autism. A study of the association between autism and dietary methanol, whose main source in the United States is aspartame, among mothers whose children were born after 1984, found that women who gave birth to children with autism consumed on average over twice the amount of dietary methanol each week than those who did not. However, Parker et al. Argue that although methanol liberated from aspartame is a toxin, causes oxidative stress, which is also associated with autism, and that its use is connected with a rise in ASD. Aspartame itself does not trigger autism. They note that previous uses of methanol, in canned vegetables for example, did not coincide with an incidence of autism, and that the removal of aspartame from Pepsi Cola did not result in a decrease in the United States. Although the breakdown product of aspartame is a potential teratogen and toxin, the studies conducted so far do not provide conclusive results confirming that aspartame also exhibits the same properties. 2. Phenyloketonuria. Phenyloketonuria, PKU, is a congenital recessive disease caused by changes to the gene encoding PAH, phenylalanine hydroxylase. When functioning correctly, PAH is in charge of the transformation of Phe into tyrosine. However, in cases where PAH is deficient, phenylalanine accumulates in the blood and brain, leading to eczematous rash, motor deficits, irreversible intellectual disability, seizures, developmental problems, autism, microcephaly, aberrant behavior, and psychiatric symptoms. Sadly, the exact pathogenesis of brain dysfunction is not well known. The symptoms can be avoided by implementing a low-Phe diet from birth. A simple test developed by Guthrie in 1960 allows the detection of phenyloketonuria in newborns. Following digestion, aspartame releases around 50% of its mass as pure phenylalanine. Following the consumption of 34 mg per kilogram of body weight of aspartame by patients with moderate phenyloketonuria, the level of plasma Phe rises to 16 millimol DL compared to 11 mmol DL in healthy adults. In addition, in healthy humans, the consumption of lower doses of aspartame, for example 10 mg per kilogram of body weight, results in an elevation of phenylalanine plasma levels from 4.5 mmol DL to 6 mmol DL, while in heterozygous phenylketonuria patients, this elevation is from 6.9 mmol DL to 8 mmol DL. A UK study found many people suffering from phenylketonuria choose products without being aware of the amount of aspartame they contain. It is believed that the sugar tax in the country increases the use of sugar substitutes, including aspartame. In addition, approximately 25% of patients reported consuming aspartame with medications. Studies have found aspartame and phenylalanine levels to vary between soft drinks. However, some consist of small amounts of APM and PHE and could be safely consumed by patients with hyperphenylalanemia and those treated with 2,2-nitro-4-trifluoromethylbenzoyl 1.3 cyclohexanedione, NTBC.